You started Ozempic or Wegovy, and now your burps smell like rotten eggs. That doesn't mean something is wrong with the drug. It means your stomach is moving too slowly. And once you understand what's actually happening, most of it is fixable. Most people quit over a smell that was always going to pass. You've probably noticed the timing. The smell doesn't show up right after a meal. It tends to arrive hours later, sometimes well into the evening, sometimes overnight. The instinct is to blame the last meal or assume the gut is just reacting badly. Both are wrong. These medications slow gastric emptying, how fast your stomach moves food out. That means food stays in your stomach far longer than normal. And that prolonged sitting time is exactly what drives the smell. The timing isn't random, and the mechanism is simpler than most people think. I'm Dr. Kim. That's the mechanism, and knowing it changes what you do next. This is not medical advice. Consult your doctor. Here's what's actually happening. A slow draining stomach is also a fermentation environment. Food normally clears in 2 to 3 hours. On these medications, it sits for 5 or 6. Bacteria break it down, and that produces hydrogen sulfide gas, the compound that smells like rotten eggs. Sulfur burps tend to peak 6 to 12 hours after eating. Many people get them in the evening or overnight, after a meal earlier in the day. The smell isn't about what you just ate, it's about what your stomach is still working through. Most people never mention sulfur burps to their doctor. They assume it's embarrassing or just part of the deal. Belching does show up in clinical trial data, but this specific symptom is almost certainly underreported. That delays the fix. The pattern becomes significantly more manageable once you adjust what you eat, when you eat it, and how much. Sulfur burps are consistently worst at higher doses, especially in the first weeks after each increase. That's the window when the stomach empties the most slowly. If yours got worse after your last dose increase, that's not a coincidence. It's the same mechanism running harder, not a sign the medication is wrong for you. Most patients assume digestive symptoms are just something to tolerate. They don't want to seem like they're complaining, or they worry it might affect their prescription. That's the wrong instinct. Your prescriber can adjust timing and dose pacing, but only if they know what you're experiencing. Most doctors also prefer to know early. The worst days feel random, but they're not. The hardest window is often the first 1 to 2 days after the weekly injection, when stomach slowing is strongest. Many people eat their biggest meals right in that window, and then blame the drug alone. Here's the uncomfortable part. The food most people keep eating through their worst weeks is often the direct cause. They think they're doing the disciplined thing. Sometimes they're feeding the symptom. Injection day and the day after are the days to go lighter, not heavier. That one shift lowers the whole week's symptom load. Most people figure this out late, sometimes after weeks of completely unnecessary suffering, when one small dietary adjustment would have made all the difference. 3 adjustments separate people who improve quickly from those still struggling at month 3. The majority are only making one of them. Here is what actually changes it. The first adjustment is food composition. The worst triggers tend to share one thing: sulfur. Eggs, red meat, and certain vegetables like broccoli fall into that category. You don't need to eliminate them completely, but reducing high sulfur foods during dose increases makes a clear difference. The pattern responds better when you reduce several triggers at once, not just one. The second adjustment is meal size. When your stomach is already moving slowly, volume and timing both compound the problem. Timing matters as much as portion size. The two tend to work against each other on the same day. Smaller meals spread across the day keep the total volume lower. 4 to 5 a day tend to reduce symptoms. 2 or 3 large ones consistently make them worse. That shift alone tends to reduce bloating and nausea as well, not just the burps. Protein still matters, but a heavy protein meal on injection day is often exactly the wrong move. What counts is not just what you eat. It's when you eat it, how much, and how slowly your stomach is moving that day. The third is eating pace and position. Eating quickly means swallowing more air with each bite. That air accumulates in a stomach that isn't moving efficiently, mixing with that rotten egg gas already building. Lying down right after a meal significantly worsens both acid reflux and gas buildup. Eating slowly and chewing well both matter. Stay upright for 30 to 45 minutes after meals. Gravity helps move food through a sluggish stomach. These changes reduce the symptom load more than most people expect. Gas X is one option available without a prescription. It breaks up gas bubbles in the digestive tract. It's not absorbed into the bloodstream, so it doesn't interfere with your medication. It won't fix the root cause, but during a rough dose increase week, it reduces the volume and frequency of gas buildup noticeably. A couple of other factors are worth knowing. Staying hydrated helps keep digestion moving. Drinking water between meals, rather than during them, reduces bloating and pressure that can make burps worse. Some people also find that carbonated drinks make symptoms noticeably worse, even sparkling water. Try swapping those out during dose increase weeks. Here's the judgment point. If burps are annoying but improving as you adjust food and meal size, that fits the expected pattern. If you're seeing persistent nausea after nearly every meal, significant bloating, or upper abdominal pain, that deserves a call. That may point to gastroparesis, a condition where the stomach can no longer move food through properly, worth flagging to your doctor. Even after symptoms improve at a stable dose, they often return when the dose goes up again. Each increase resets the window. This isn't permanent sensitivity. It's the same mechanism at a higher level. The body adapts again, usually faster the second time. For most people, symptoms are worst in the first 2 to 4 weeks after each dose increase, then gradually improve as the dose holds steady. In some studies, most patients saw improvement by week 6 to 8. People who make all three adjustments at once improve faster. Those who address only one tend to still be struggling at month 3. Here's the one thing to hold on to. Sulfur burps are a side effect of how this medication works, not a warning sign. Cut back on sulfur-heavy foods during dose increases. Eat smaller, eat more slowly, and give your body time to adapt. Stay upright after meals, and give the gut 4 to 6 weeks at a stable dose. Most people who make these adjustments find it does improve, often within weeks. Those who stop over this one side effect rarely realize it was only temporary. The symptom passes. Quitting doesn't have to be. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.